My name is Maria Stella de Rocchis. I'm a project officer at EFCA. Now it's IFCA, International Federation of Crohn's and Colitis Associations. Our mission is to improve quality of life of people living with IBD, and our vision, of course, is to find a cure for IBD. We are aim at improving life of these people, and so we organize different activities internally, and we work together on some different areas like networking, advocacy, raising awareness, research and development, solidarity. And in the miGut project, as a project officer, I'm responsible for the planning, for the coordinations, and for the execution of the many activities in which we are proudly involved, I would say. And we collaborate with the Università Cattolica, and with them we identify together questionnaires to be disseminated to patients to investigate a bit more about the stress and related food habits in the framework of the project, of course, and we also support URIs in the dissemination and communication of the many findings during the life of the project. And our main goal, of course, is to involve our patient perspective, our patient lived experience, and since the beginning of it. Yes, these symposiums for us are really important because they translate the research approach in the real context, in the real need of the patients. So it is important that the project coordination is able to translate all of the research, all of the findings, all of the work in some practical solution for people living with IBD. So, and I'm glad to see that patients are also invited to attend this kind of meetings, to be included in the discussion, to make questions to the researchers and to try to understand what's happening on the research side. This is really important. And for us to be our patient representatives of people living with IBD, it's important for us to be there to bring lived experience of patients, of any patients. So as we all know, IBD is really different. It's a really unpredictable, and this disease applies different from person to person. So bringing all the different perspectives into the project in this type of meetings is really essential for us and really helpful. Yeah, unfortunately, we still have many of them. So first of all, IBD is an invisible disease. This means that people suffer every day of the most common symptoms, but it's not really visible because the symptoms are like fatigue, are joint pain, stomach pain, urgency and pain to go to the toilet. And this is something that other people don't understand, that is not visible from outside. And it doesn't mean that these people are not suffering. It's difficult to explain and to be understood sometimes. And secondly, this disease is not the same for everyone. So if something applies to a person, it doesn't mean that it applies for every person. So some people can experience also some complication of the disease. I'm not mentioning all of them, but just to give you an interview, we have fistula, we have fibrosis, which are very hard complications on our IBD. And in this case, you can see the burden that patients live with. But in the other case, patients have mild symptoms, but it doesn't mean that they don't have the disease. They also live with the disease. Another misconception is that IBD can be solved with the diet, which is, as we are also seeing in these days, is not true, because the cause is not really known right now. What's the cause that led to inflammation? We don't know yet. So the cause are still a lot. We have environmental factors, genetics factors. We know that IBD is an immune system disease, so there are multiple, and we don't have to make people and patients and people living with IBD guilty because they don't eat properly, because it's not something like that. It's not only related to this. So it's a mix of many factors that can have an impact of the disease. So it's not just about diet, but of course we have to work also as a patient organizations in the education of patients to be able to follow the right path, also including diet, but it's not the only one that we should take into account. And another misconception is about surgery, because patients with IBD undergo surgery. Sometimes it happens, of course, but the surgery doesn't solve the problem. So it doesn't mean that once you go you receive the surgery, then you are fine, you are okay, the disease disappears. The disease is still there, the inflammation can occur anytime, so we must be all careful on how to handle this really complicated disease and how to interact with patients. Yes, of course it does, and so that's why for the second year in a row for the World IBD Day campaign, which happens every year on May 19, we decided to bring to the society the same theme of last year, so breaking taboo, because of course IBD is still a taboo for the population, but for the patients themselves, because of course it affects the bowel movements, so the diarrhea. So these topics, these subjects are still a taboo in the society, in every society, and this can lead to patients to not to go to the doctor because they're embarrassed to talk about what is happening at the bowel side. So, and this can also lead to a late diagnosis. So it's really important to raise awareness about what is the inflammatory bowel disease, what people should react in front of patients, what a patient should do, because it's important to raise awareness to make this disease visible to everyone. And because it's an embarrassing disease, it can also lead to mental issue and can also affect the psychological side of the person, because of course it doesn't feel. The people affected by the IBD, they don't feel understood, they don't feel comfortable with speaking with other people around them, because it's still a taboo, and we have to make our effort to raise awareness every year about this. So how we tackle this stigma? The World IBD campaign is one of the support that we have to address this type of problems, because of course if raising awareness about this, it means that people will be acknowledged about the disease, and also patients will be more comfortable to speak about this. So it's all about that. Our aim is also to create open dialogue between patients, patient organizations, healthcare providers, which is something that we have been doing in Horizon projects and also in miGut projects, create an open dialogue with all of the stakeholders involved in the discussions, policy makers also, and other kind of organizations like our European Crohn's and Colitis Organization, our ECO, and UEG, United European organization. So it's important that we address the problems and the burden of this disease with all of the parties involved in the discussion. And another important things that help us to tackle the stigma is to share personal stories of patients living with IBD. And this is something that we also do with miGut project. If we share the real impact of the disease, we make it real, we make it understandable, and we make an impact. So it is also really important. And last but not least, create a safe environment, which means that EFCA and also the 46 member associations are important to to talk with these people, to meet them, to encourage them to speak about this openly in a safe environment. It means that it is important that we organize meetings and events and also camps with our patients in which they can meet with gastroenterologists, with psychologists, with nutritionists in a safe environment, so everyone feel comfortable with. And in the meantime, and at the same time, we also raise awareness about IBD. In miGut, our main aim is that the research, the project, so the study will remain patient-centered from the beginning to the end of it. And it really has the power to translate all of the research findings in real and practical solutions and supportive alternative for patients. So in the miGut project, we are involved in very different activities. So first of all, we bring our patient voice into it. So it means that we are aimed to provide the lived experience with people living with IBD into the projects, and also guide the research on the development of new tools or on surveys like it's happening in the miGut project. We are also supporting in the engagement of patients of patients associations. For just to give an example, we are collaborating to bring different patient voice from the different countries in Europe, and this means that we involve our patients group all over in the targeted countries to be part of the projects, to be the person who can make a change, in this case a positive change, in the course of the research. So we always ask for their support, for their feedback for any part of the research. We try to incorporate their perspectives, their experience in the many activities that we do. We also work in miGut to bring a patient voice. This is another important aspect of our participation, because we bring to the projects a real experience of patients just by telling what is living with IBD, what's his quality of life, what are the battle that they fight every day with this disease. Just simply that, it can really make a change for everyone. So many things, I have to say. The participation of the patients from the Faroe Islands and also some nurses from the gastroenterologist department here was great. I had the opportunity to meet with them for my first time and to exchange a bit information regarding their organization, how to communicate with patients, the activities that they do, and what is living with IBD in the Faroe Islands. And they were very engaging, and they could make us aware of the many things that happen here in the Faroe Islands. So first of all, that it was surprising to see that the highest incidence and prevalence of IBD is actually here in Faroe Islands, and the progress of the project and the results that will be achieved soon in this cohort of patients. We hope that it will be an example for all of the cohort patients in the world, for all of the patients community in the world. So we really hope that this study here located will be very supportive and an example for all of the community worldwide. Yes, what gives me hope is the continuous and increasing recognition of patients and patient representatives in the discussion. And this is something that we can say and we can really touch firsthand. Our involvement, our participation is increasing a lot all over the board and all over the projects, and this means that we will be able to shape the quality of care and the quality of life of people living with IBD, which is really important for us. And on the other side is always, it's incredible for us to see the development in terms of research and on the technological side for the new treatment and for the new improvement in the disease. And now we are discussing a lot about artificial intelligence, personalized medicines, all of the advancement that are happening in this Horizon Europe projects. We are very optimistic. We have to say that we are really very optimistic. And as a patient community, we are really great to work together as a community, not only with patients, but with patients representatives worldwide, with all of other stakeholders, with policymakers, with researchers, with gastroenterologists. We are really a global and united community, and this is also reflect our motto, which is United We Stand.